Welcome to Thriving with ADHD, a podcast where we'll share everyday practical tips to thrive in life as an adult with ADHD. This podcast is brought to you by Animo Sano Psychiatry, a behavioral health practice with a specialist ADHD clinic based in North Carolina. And this is your host, Nada Pupovac. Welcome to Thriving with ADHD, dear ADHD community. This month, we talk about ADHD and medication, myths, facts, and finding the right fit. I'm really excited to introduce our guest speaker, Meredith Rappaport. She is Animo Sano's physician assistant, and we haven't had the pleasure of having her on the show yet. So I only hope it's just the first time of many. Let's learn more about Meredith before we jump into our conversation with her. Meredith Rappaport is a dedicated and compassionate physician assistant who feels incredibly fortunate to contribute to the mental health field. She has a strong curiosity and profound interest in how people think, feel, and grow. Since 2008, Meredith has been dedicated to the mental health field, initially working as a social worker and psychotherapist. She later returned to school to become a physician assistant, continuing her work in mental health field as a medical practitioner and prescriber. Her holistic approach combines medication management with a deep understanding of psychotherapy, ensuring comprehensive and empathetic care for all her patients. She continually strives to provide the best care possible. Meredith also offers child and adolescent psychiatry services besides the services for adults. Meredith, welcome to Thriving with ADHD show. I am really happy to have you here because it's your first time, and I know that our patients love you, and I know that you have a lot of knowledge from social work, psychotherapy, now physician assistant. Just your experience is so rich within the mental health field. So that's why I think you would be a perfect person to talk about some of the topics that interest our ADHD audience. And this time you came to the show to talk about ADHD medication, very important topic. We're here to bust some myths, to talk about facts and finding the right fit. So welcome.
Yeah, thank you. Thank you for that intro.
Yeah, that's no problem. We can jump right into our questions. So my first question for you would be, can you explain the different types of medications available for treating ADHD, including stimulants and non-stimulants, and how do they differ in their mechanisms and effects?
Okay, so we have several things we can do for folks that are struggling with ADHD and have tried a lot of behavioral hacks, if you will, and are still struggling. It's kind of different in what we do with kids and adults, but generally the classes are the stimulants, the alpha agonists, and then there's also some supplements that can be used. But for stimulants, there's kind of two main groups, the methylphenidate group and the amphetamine group. And among them, colloquially, you probably hear them referred to as the Ritalin group and the Adderall group. And then you have in the alpha agonists, you have clonidine and guanfacine are the two main ones that we use for various things, as ADHD among them. And then there's also things you can do cognitively, because you have to remember your brain is a biochemical machine and it needs the right fuel. So there's there's things in the brain nutrients we need to get to make neurons and to keep neurons healthy. So there's also supplements. And among those that I use would be omega-3 fatty acids, N-acetylcysteine, and vitamin D, as well as there's some small studies that support using American ginseng for adults. And then for kids, there's a couple more things that I could mention, but they're not the medications, which is what you asked about. The mechanisms and effects. The alpha agonists, which I'd like to start out with in kids, because if they're really young, we really don't like to give stimulants as much as we can avoid it due to the side effects. They were developed to be blood pressure medications, and they just seem to increase the executive function in the frontal cortex and the prefrontal cortex. And I don't think exactly sure why, but they help especially good with hyperactive kids, boys in particular, impulsive, hyperactive, and kind of helping slow them down a bit, helping them function better in terms of, like I said, that executive function, so cognitively. The guanfacine is the typical one I would use. They both cause sedation. Clonidine is also used as a sleep aid frequently in mental health. And then the stimulants, these are reserved for, when people have impairment in function. If you really can't function socially or in school, and like for kids, we don't necessarily want to give stimulants to kids because they suppress the appetite, they suppress sleep. So sometimes kids will end up being on, multiple medications because of insomnia and because of loss of appetite. We want them to hit their growth curves. But stimulants, the amphetamine kind of pumps dopamine from the brain. So it pushes the brain to create more dopamine, and it also modulates norepinephrine. and these chemicals seem to be involved in ADHD. I wouldn't say lacking, but somehow, the brain's really complicated. But what the amphetamine will do is it'll kind of push the brain to make more. Kind of like in a diabetic medication, you had a sulfa drug. Sorry, that's hard to pronounce. Sulfonylurea drug. They will pump the pancreas to make insulin. So this will pump it. And that's kind of, it's a lot for the brain to take sometimes. So if you take that medication, you may feel it's the reward system. So dopamine is your reward system. It'll make you feel good initially. That eventually goes away at any dosage, initiation, or increase. And that's part of why it's considered habit forming, I think. So for the first few weeks or month, maybe you have better mood. You have more energy. You're more talkative, more outgoing. A lot of those things that people like, or suppressed appetite, those things will eventually fade. But what you should be left with is still these other benefits from the medication, which is improved initiation of tasks, motivation, concentration, attention. The methylphenidate, it's not quite as simple as sort of pumping the dopamine from the brain. It's sort of I wouldn't say prevents reuptake, but it's a little bit different than the amphetamine. And I'm not sure that I'm the one to explain that, but it doesn't pump it as much. We have evidence for kids taking it long term without detrimental effects. We don't necessarily have those studies with that show. We don't really know necessarily the long term effects of taking the amphetamine as much. But the methylphenidate's a good medication too. That's the Ritalin family, and it just helps improve and create more dopamine and norepinephrine in the brain. And it does seem to help improve attention, focus, and same things as the amphetamine group. It does tend with kids sometimes, which is the one it's our medication of choice for kids, the methylphenidate. And it does sometimes, unfortunately, produce emotional breakdowns or crashes at the end of using it because these things are so short-lived. So the stimulants are short-lived, take them in the morning, and they're fading from the system all day, as would your normal attention. Then you have non-stimulants that are also not, they're called, sorry, I forgot to mention these, the norepinephrine dopamine, if it's norepinephrine reuptake inhibitor, and that would be Qelbree and Strattera. Strattera is the old one that's been around forever. It's also called atomoxetine. And, I don't find a ton of efficacy with it. A lot of my colleagues will use it and seem to have patients that like it. I personally have found that it's pretty, in general, not very effective for my patients. So they have a newer one now called Qelbree. It was FDA approved for children several years ago. That's Qelbree, very odd name. But it was then a few years subsequently approved for adults as well. Major side effects would be sedation in children and insomnia in adults, counterintuitively. So Qelbree is FDA approved for, and Strattera FDA approved for ADHD. It's a one a day, adults in the morning, children at night, not controlled substance that is probably a little more subtle than taking a stimulant where you feel like you've taken a drug. This just seems to work. Again, it's kind of more like an antidepressant in that it prevents reuptake of these which is kind of like recycling, if you will. It prevents the recycling of the brain chemicals, dopamine and norepinephrine. And then supplements, that's a whole nother podcast.
Okay, we can save that for another time. You know, how they say you knocked it out of the park straight away, and just with the first question. So many great things that you shared with us. I would also like to mention that, and I have this in our intro, that you specialize in child and adolescent psychiatric services. So I'm really delighted that you're making comparisons between medication for kids and then for adults. I think this is where you bring your expertise, and as well as making comparisons between these two groups, which is amazing. So I really, really appreciate that. And I'm sure everyone who is listening to this, and maybe they're adults with ADHD, parents with ADHD, have children, I think this will be very helpful and useful for them as well.
Exactly.
So my next question would be, how effective are ADHD medications in managing symptoms, and what are safety concerns, considerations, and potential side effects?
Well, stimulants are very effective. In fact, they're going to be effective for just about anybody, whether you have ADHD or you don't. They're going to force you to hyper focus. And it used to be thought that there was a paradoxical effect that they would, only help, not paradox, that they could make people with ADHD more tired, or, not as stimulated, or that if you responded to the medication, you have ADHD, but it is not a diagnostic tool. They work for everybody, kind of like alcohol works for everybody in that same way. If you drink enough, you will get drunk. If you take a stimulant, you will benefit in that you have hyperfocus and attention. Most people respond the same way, in my experience. And that would be that, it tends to, just like I said, get you to motivated to get things done, to focus. Unfortunately, ADHD develops for different people in different ways. And we don't talk a lot about where does ADHD come from. That'd be another good podcast. People just assume it's genetic and you have it or you don't. And that's not the case for everyone. But when you take a stimulant, sometimes it can make you more anxious. If, for instance, you developed ADHD as a coping mechanism from having a chaotic childhood or a chaotic mind full of anxiety, if you developed the coping mechanism of suppressing attention to the things that are going on, whether inside your mind or out, then this strips you of that. So it can have the side effects sometimes of increasing anxiety in some people. But it does tend to act more centrally in the brain than peripherally in the body. So it's not like you can't take it if you have anxiety disorders or that kind of thing. Let's see. So the big side effects with the stimulants would be insomnia, loss of appetite, dryness, dry mouth, dry membranes. Excuse me. And I suppose there are some rarer things that I've seen, but those are generally what you would see. I don't see a lot of stomach upset or things like that. But most side effects, you just maybe want to take it with food. And the safety considerations are, especially in kids, like we use this only if we have to, because it can suppress their growth. If you're not eating properly and sleeping properly, you may not be meeting your growth curves. And so you want to make sure we're finding the right medication that doesn't suppress the appetite too much, and that the pediatrician's okay with as well. The non-stimulants, as I was talking about clonidine and guanfacine, the big thing there is going to be sedation. And these, again, are meds we're typically using in children. For some reason, the guanfacine doesn't seem to continue to work past adolescence for most people. I've seen maybe a handful of people taking it as adults. But the big thing there is somnolence. I have to really do a lot of expectation management and understanding of symptoms and side effects, or how these things work, because parents will often say, my kid is a zombie. So we have to really initiate it slowly. And we have to know that side effects like that do fade over short periods of time, usually just a few days. The non-stimulant medications and the norepinephrine, dopamine reuptake inhibition, the Qelbree and the Strattera, They can have side effects like upset stomach. For children, the big one is insomnia. For adults, for children, the big one is somnolence, sleepiness. And for adults, the big one is insomnia. Not really sure why. And let's see, they kind of, like I said, operate more kind of like a antidepressant. So you may have things like upset stomach, headache, fatigue. I already mentioned decreased appetite can happen too. You can get a little blood pressure spike. And I'm sorry, I did not mention with the stimulants, that is a big one, is that we can have increased heart rate, increased blood pressure and things. So we really don't want to use these with somebody who has cardiac issues or is hypertensive. And the same thing for the Qelbree and the Strattera. Now, the guanfacine and clonidine do reduce blood pressure, as I mentioned before. So those are some of the potential safety risks and side effects.
Okay. So with all of these in mind, how do you determine which medication is right fit for a particular patient?
Yeah. Well, first of all, age is a big one. If somebody's 5 years old, 6 years old, 7 years old, I don't love to give stimulants. So I'm probably going to start with the alpha agonists, even though the textbooks would maybe tell us to go for the stimulant. I think that's a big risk. And, it's a big, you really weigh risk against benefit when you start with a stimulant at a very young age. And so I was trained in the neuropsych profession by a doc who had board certifications in psychiatry and neurology. And that's how I was trained, was to start with the alpha agonists, because you don't necessarily want to initiate those side effects, things that are habit forming. And so we start with guanfacine, typically in the young kids. And if they're really, really hyperactive, like I said, that can be good. If boys that are hyperactive, and actually Qelbree is good for that one as well. And so I'll use that. Like I said, I don't typically use Strattera or atomoxetine, but again, another colleague could probably tell you more about that. I was trained that it's not that effective for people. And I've also seen that people have it on their med list of meds tried. So that weren't effective necessarily, but not here to, I'm not bashing this medication. This is just my experience. Mm-hmm. So I would probably choose one of the non-stimulants for a little kid first. And we could even do Qelbree, but a lot of times, we try guanfacine first. The stimulants are good for kids that are inattentive. They can help curb some hyperactivity depending on the child. I will choose for adults, the first line therapy, according to the algorithms in the textbooks, is going to be an amphetamine. It's going to be the Adderall family, and there's many meds that are in each one of these families that are similar and but also dissimilar in some ways. So that's what they would have us do. But I give people all this information I'm giving you so they can make a choice that's right for them, because again, there are risks involved, like a medication becoming habit forming with the stimulants, having to be monitored by the DEA, only being given 30-day prescriptions, things like that. I think that most people are familiar with those stimulants and their side effects to some degree, and are interested in those medications because they do like some of the side effects, which are appetite suppression and not necessarily insomnia, but and they know that they're effective. So a lot of times, like I said, we start there. Methylphenidate, more so in kids, is where I'll start, is with the methylphenidate group, because I used to give these challenges in my last job of giving, and I'll do this occasionally, a week or two of one and a week or two of the other. I prescribe both and then have people come back in and talk about what they like, what they didn't like. And this has some benefits in that if we're going to a more classy med after this, the insurance company would like to know that you've tried both. And now we've already tried both. But often I would find, I'd say about, there's a handful of people that are adults that do better on the methylphenidate. It's not as much as who appreciate the benefit more from the Adderall family or the amphetamine family, but it's less, but there are those people. So I can do those challenges sometimes with people or trials with a stimulant medication. And for people who don't want a stimulant, who don't want a controlled medication, or who have failed these medications, or who would prefer to try something starting somewhere else, we can do Qelbree. And I have had good results with that for adults and kids. It seems to work pretty well. And I think this is one where, primary care is happy to pick it up if you had to move or something. A lot of times primary care will not prescribe controlled substances. So it can be an easier med. It's just one that I present to people. I don't necessarily say, okay, this one's better for you, although I do think it's pretty good for, like I said, young boys who are very hyperactive. And this one, it's just one that sometimes people prefer because of that, or that if they're kids, maybe they failed the others.
That's really, I'd say, important and smart what you're doing. Just trying things out, gauging what works for people. I think it's just brilliant. So to connect to that conversation, what are alternative treatment or complementary therapies that can be used in conjunction with the medication to manage ADHD symptoms effectively?
Yeah, I listen to a lot of podcasts from the Carlat psychiatry folks, and they cite studies better than I probably would do right now. They had. If you want to look at studies about what is helpful in conjunction or for ADHD, that's a good place to go to get evidence-based information. And one thing that they have talked about on there is exercise is really important for people, especially. I've had a lot of patients who have managed their ADHD, particularly hyperactive type, for their life by playing sports, being very active. And that helps it, not just them feel happier, but it also helps with brain, the cognitive function. In terms of other things that help that cognitive function, I mentioned before, there are some supplements, and there's even conjecture, there's theories that there may be a zinc and copper imbalance in people or children with ADHD that I don't, so some people will, take one or the other, but I think you'd want to do that with a practitioner pretty well versed in that. But things you can generally do, like I said, our brains need the right fuel because they have to build and maintain cells, which are the cells of the brain, neurons. And neurons, are things like vitamin D, amino acids, omega-3s are necessary in order to build and maintain those cells. So if you don't have enough vitamin D, it has everything to do with serotonin as well. But you see, if people are low in vitamin D, depression, anxiety, suicidality, inflammation, inattention comes with all of these things. So that one's really important. And actually the vitamin D cutoff for primary care is probably lower than what we need for our brains to function well. Ideally, it should be 40 to 60 optimally. Somewhere in that range. Then the omega-3 fatty acids are great for the brain. We've got studies that show, they help people with Alzheimer's. They just really help maintain that cognitive function. And they're naturally found in foods like eggs and seeds. But a lot of times we don't get enough in our diet. So I tell people pretty much the brain health triad would be N-acetylcysteine, omega-3, and vitamin D. I take all of these myself, and I have noticed quite a robust difference. Although you may not think so, I don't know. You have to tell me. But the N-acetylcysteine is an amino acid, and we need amino acids to build protein, and protein is what we need to build cells. So the amino acid N-acetylcysteine is used for various things, all kinds of different things, but it does seem to help, like I said, improve. You get results in that you see, that one thing I use it for is trichotillomania. So people who pick eyelashes and they pick their eyebrows or their hair out, it can help with that. It is liver protective. N-acetylcysteine is what you'll be given if you go to the hospital and you have an overdose on Tylenol or something that's killing your liver. So it is liver protective. It Also can be used for slowing cravings, reducing cravings of things like people who want to reduce or stop their marijuana use. It's just an interesting thing, but I guess because we need maybe, and we need amino acids. There's several essential ones, and there's some that the body create, and there's some you have to get from diet, and we often don't get what we need from our diets. Mm-hmm. So this one, it's got to be taken at fairly high levels, unfortunately, and 3 times a day, for whatever reason, you have to, we want to get up there to, 1200 to 1800 or more. So that one is a lot. And the omega-3s, you want to get up there too, but not go too far. So something to do with your prescriber. Okay. Then there's also American ginseng that I mentioned earlier. There have been some studies that have shown this is effective for adults and children, kind of taken the same way stimulants are taken in the morning. And then additionally, again, if you need to do homework, things like that. So some folks, and it doesn't have very many side effects, which is nice. That's another consideration, or side effects. So American ginseng is not going to have much in the way of side effects at all. Doesn't interact, I don't believe, with other medications. And it can be taken, like I said, multiple times a day. It's shown in some studies that it's been effective for improving cognitive function, helping you think things through, just in general, better executive function. It's been described by people, as I've heard on the Clarifies psychiatry, as going from like a tube TV to high def. Mm-hmm. So those are some things. Also, just getting the right amount of sleep and energy. I mean, there's treating any other coexisting problems like depression, anxiety. These things take away our attention and focus as well if we're focusing on other things. And then there's for kids, there's a few other things. There's some stuff that, like I said, would be another podcast, but I'll just mention them briefly. Rhodiola rosea. Then there's pycnogenol, which is a French pine bark. And I think I'm missing one. I'll have to think on that, but get back to you. But there are several things for children that have shown in studies to be effective. Yeah. No, I believe those were the only ones I wanted to mention, but not so much in adults. And I could talk about, that at length, but I won't.
That's fair enough. We will save that for the next time. And yeah, we always put an emphasis in the show on education for patients and families with ADHD. And the same applies to medication for ADHD. So what would be your key points for people and families that deal with ADHD? And what are the things that they should be aware of?
Well, they should be aware of other therapies because, a lot of times psych medications, they provide some relief of symptoms, but they don't change your life. They don't do the things for you. So we have to decide what we're going to do with that feeling of relief and doing better. So one thing is just living the feeling better thing. So like the more you engage in the activities you once avoided or weren't doing because of the disorder, that helps train the brain. And that's a good thing. But also there are groups and podcasts and support groups and things like that, and books. Patients have brought to me so many books that they like and they use, or certain types of planners, exercise, finding that effective. But there also are therapies that are given. And one in particular that's terrific for kids and parents is parent-child interaction training, or PCI. And that can be done by psychotherapists. And you basically will have a therapist or psychologist, some type of practitioner who watches you interact with your child, and then will teach you or coach you on how to understand what it's like for them mentally, cognitively, and how they experience the world, and how to have effective strategies. Because there can be a lot of butting heads in family when this happens, which is why one of the realms we considered, impairment in this disorder, if you have problems within your social life and your family life. So that's a good therapy. There's some others. My supervising physician would probably suggest this one above others. And then there's going to be in terms of what you do outside of the home. In terms of in the school, there's lots of different things that can be done. There's different types of educational psychotherapeutic modalities that are used sometimes in the school setting. I'm not really well versed on those because I'm not in the school setting, but I know that they also, one thing we do is accommodations for people. We may write letters to let people know that accommodations are available and needed and necessary. Sometimes people need more time on tests or to take a test in an isolated situation or to have things in written materials as well as audio. So different things, but education for patients and their families about medications is important, and you often get that from your practitioners. And I think that everything you get online or that's just sort of generally out there, you have to kind of be skeptical about. It's wise to check with others and see, is that really valid? Education is just important in life in general for everything we go through. I think it can be you get more control over something the more that you know. And so it's essential. I mean, you definitely want to, people sometimes suffer with things and it's difficult to know what to do if you don't know what you're dealing with. So educating ourselves is key. It's very essential.
Yeah. I mean, you gave us a lot of food for thought, and I'm sure we will meet again to discuss some other topics here that you just touched on. But if there is one thing that you would like our listeners to take away from this episode, what that would be?
That maybe we should be looking and talking about where ADHD comes from, not necessarily just that it is. And that's something I'm pretty passionate about, but also that stimulant medications have come with a lot of risk. And one of the things that can happen is people become dependent on them, think they can't function without them. And then they feel like a really sick person. There are ways to function and cope and that are not medication based. There are also, medications can kind of augment those things as well as, provide relief for people who are really, really suffering. So they shouldn't be taken lightly. Taking a stimulant medication comes with a lot of risks. And one of the things people think a lot is when they don't take their medication for a day or two, that this is how they're going to be. This is their baseline. Wow, I'm really useless without this medication. But that medication, if it's a stimulant, has been pumping the dopamine, and your brain needs a few days to get back online doing that itself. So remember that is not your baseline, and that, medications can help, but again, not to be taken lightly because of the potential to feel that you can't function without them.
Mm-hmm, mm-hmm. Thank you so much. This was eye-opening conversation, I'd say, and it was useful, and I hope it was useful to people who have ADHD and potentially children with ADHD. And I love that you gave us a great comparison between different age groups and what works for one and what works for the other. So again, I think this is a great benefit to this conversation. So thanks again, and I hope we will have you in the future soon.
Well, thanks so much, Nada, for having me.
No problem, you're welcome. Thank you for listening to Thriving with ADHD. This show is produced by Animo Sano Psychiatry. Please follow, rate, or share our podcast on Spotify, Apple Podcasts, or any other streaming app of your choice. Music is by Daddy's Music from Pixabay. For more information about Animo Sano Psychiatry, please visit animosanopsychiatry.com.